Temperatures certainly on the rise, and that has had people rushing to the pool to cool down. But there are still concerns out there over COVID-19 and how it can spread. So we're going to get you some of those answers this morning. Arica D'Souza is from Banner Health. She's the Arizona Community Infection Prevention Director. Arica, thank you so much for joining us.
Sure. Thank you for having me.
So,
I'm glad to be here.
yeah, we're glad to have you. So the number one question certainly that people have had, and we saw it over the Memorial Day holiday with public pools packed with people already, is there a possibility for COVID-19 to spread in pool water?
Yes, that's a great question. And, the onset of summer usually signifies and is synonymous with pools. So what we know thus far from the CDC is that COVID-19, or the virus that causes COVID-19, is not transmitted through the water. So there's no evidence to suggest that the virus can survive in our water, and the disinfectants that are commonly used in water, like chlorine and bromine, can actually kill COVID-19 virus. So that there's no risk there. However, there are certain things that we need to be vigilant about, and that is maintaining that 6 feet of physical distancing, social distancing, in and out of the pool. And that can sometimes be challenging to do in settings like community pools, and other public aquatic venues.
Right, because there are no, like, stores have put the 6 foot marker. You can't do that in a pool. I do want to circle back for a second so if COVID-19 can't survive in water, the thing that people might be confused of is there are viruses that can survive in water. We talk every summer about Cryptosporidium that kids can get. So what's the difference that people need to know about?
Yeah, so Cryptosporidium is actually a different organism. It's an amoeba, so that does obviously have a lot of concerns in pool water, and our common disinfectants that are used to disinfect pool water cannot work on Cryptosporidium, and those can actually survive. So we do need to be mindful of that risk during the summer months. That still has not gone away. You can still experience Cryptosporidium even in the summer months in the water, but it's a totally different organism.
Do we know that's important? That's an important distinction. Do we know also, because it's gone back and forth, does the heat help us with COVID-19 and stopping the spread, or is it still unclear?
I would say it's unclear. We need to still maintain our usual preventative strategies, which would include, staying home when you're sick. Do not visit these venues if you are unwell. And then if you do go there, maintain great hand hygiene. I always recommend taking hand sanitizer in abundance when you go. Also carrying a pack of little disinfectant wipes with you to, disinfect commonly high-touch surfaces. Because you just don't know when you're out in public how well surfaces have been disinfected.
Right, you have to trust yourself and your personal hygiene. Don't trust what others are doing so much. So high-touch surfaces, that would be like pool chairs, for example.
Correct. Pool chairs, hand railings. The other thing I always recommend is don't share commonly used pieces of equipment. So goggles, snorkel, eye protection, those are hard to clean and disinfect. And so I would not recommend sharing those. Even kids' toys that are used, to play with, try to keep those contained within your own children's environment.
And the last one of another tip that we see anytime that we go to the pool, really, but this is also what Banner is suggesting, is shower first before you get in the water. Why is that important? Why does that matter?
Yes, it's always good to shower first, regardless of COVID-19 being around or not. And that just helps remove any surface bacteria, emollients, anything that's on your skin, sweat, before you enter into a public pool or water body. So that way you're not further contaminating that or polluting that with what could be on the surface of your skin.
Okay, excellent tips. And especially I hear the common theme that you maintain throughout is, even if you're in the water, if half of your body is out of the water for a lot of the time too, that 6 foot distance is really what's going to help you out.
Yes, definitely try to maintain that. And that is difficult. That can be challenging to do, both in and out of the pool. But be cautious and be aware of your surroundings when you're in those environments.
Yeah, we know it's hot. We know people want to cool off, but we've got to do it safely and well informed. Thank you so much for your time and for your guidance on this to really help clarify some of this for the rest of the community.
Sure, absolutely. Glad I could share.